for this week's Sunday brief. Today we have a brief on one subject and one subject only, on COVID-19. First, to introduce to you a number of officials who are with us to support us with today's brief, and then I would invite them to do various parts of the brief. The Honorable Henry Quartey, Deputy Minister of State in charge of National Security, he is with us. Dr. Mrs. Martha Jansalutrot is the Acting Chief Director at the Ministry of Health. Dr. Da Costa Boaje is Director of Health Promotion at the Ghana Health Service. Dr. Anthony Insiasari is a Presidential Advisor on Health at the Office of the President. Dr. Bedu Akodie, who is here with me and will be doing the first part of the brief, is a Director of Public Health at the Ghana Health Service. Dr. Sally Ann Hine is with the World Health Organization. Dr. Nima Kimambo is the WHO representative in Ghana. Dr. Siedu Bequin is head of DSD at the Ghana Health Service. Dr. Patrick Abuaji is the Director General of the Ghana Health Service. The Honorable Ban is the Deputy Minister responsible for health. I would acknowledge some other persons from surveillance and other pieces as we go along. The Honorable Deputy Minister for Information, Honorable Pius Sam Hajide, is also here with us this afternoon. This afternoon's brief is in 4 parts. First, Dr. Bedu Akodie will give us a brief on the index cases that were announced on Thursday night and the contact tracing that were announced to be commencing at that time. He would also give us an update on whether or not there are any new cases here in Ghana. Then Dr. Patrick Abuaji will join us with some announcements to read through what they call the triage protocols in all the hospitals and clinics across the country. It's very important, particularly for health care workers across the country. He will reiterate those protocols. The government of Ghana will this afternoon issue a travel advisory, a very important travel advisory, a public gathering advisory, an update on public education, and a media advisory, which I will do later. And then the Honorable Deputy Minister for Health will wrap it up for us with some comments from the ministry that is leading this agenda. That is the ministry responsible for health. So please join me to welcome Dr. Bedu Akodie.
Thanks very much, Honorable Minister. Your Honor, Ministers of State, heads of agencies, our partners, I can see WHO here, friends from the media, Ghanaians. I provide this date as a follow-up of the press brief by the Minister of Health and Information that announced the first 2 confirmed COVID-19 cases, and consequently declared the outbreak in Ghana on the 12th of March this year, 3 days ago. Both individual index cases returned to Ghana outside the country, one from Turkey and the other from Norway. Hence, the 2 cases were both imported. The first case is a man, resident in Accra, who returned to Ghana from a trip in Turkey on the 29th of February this year. He developed symptoms on the 10th of March and reported to a health facility on the same day. He was identified as a suspected case of COVID-19. Sample was taken same day. The sample was sent to Noguchi Memorial Institute Medical Research, and within a short while, we had the report from Noguchi confirming that Ghana has confirmed the first case of COVID-19 in the country. The second case is a 60-year-old man, a Norwegian, who returned to Ghana, Accra, on the 7th of March. He started develop pain symptoms on the 12th of March and reported to a doctor on the same day. Sample was taken, sent to a laboratory, specifically Noguchi Memorial Institute Medical Research, and we received reports later in the day indicating that this is also another confirmed case of COVID-19. The two reports came the same time because the samples were sent and they were worked on the same time. So we had simultaneously two confirmed in this case on the 12th of March this year. For both patients, cases had no symptoms on arrival at the time of crossing our borders. And later, they presented with acute respiratory illness. We had evidence of exposure. They had been to areas where cases had been confirmed. Both cases are currently being treated under isolation conditions, and the two are stable. Contact tracing has started. I'll give details later, and it's ongoing. On Friday, the 13th of March this year, 2 days ago, not too far, two more cases were confirmed as COVID-19. They reported in two regions, one each from Ashanti region and the other Greater Accra region here. The first is a 56-year-old man, a Ghanaian, who returned from a trip in the United Kingdom on the 4th of March. He stayed in UK for 10 days and came back. He developed symptoms on the 12th of March, reported to a hospital in Obuasi, and the case definition met the case that of suspected COVID. Samples were taken. The sample from this case was sent to Kumasi Collaborative Center for Cases for research. And within a short time, the lab reported back to us that they have finished the assessment of the report, and this is another confirmed case of COVID in the country. The second is a woman, a female, and a student, Ghanaian student. She traveled out to the United States of America, stayed for 10 days or so. She came back on the 9th of March, and then on the 13th of March, started having symptoms that later were evaluated to be compatible with a suspected case of COVID. Samples were taken, sent to Noguchi Memorial Institute Medical Research. Samples were taken on the 13th. The same day, we had a report from Noguchi that confirmed this as another confirmed case of COVID-19. Both are currently receiving treatment under isolation conditions, and both are stable. I'm talking about the two of them that were seen the 13th. Yesterday, late in the afternoon, we received a report of two new confirmed cases from Noguchi Memorial Institute Medical Research. The first is the 42-year-old Ghanaian male who returned to Ghana on the 8th of March. He had traveled to Switzerland and UK in the past 14 days. Symptoms started on the 9th March, and he reported to the health facility on the 14th March. Samples were taken, sent to the lab again, Noguchi Memorial Institute Medical Research. Within a short while, we had the report, and this was confirmed positive. The second case was a 41-year-old Ghanaian male. He reported to Tema General Hospital on the 14th of March with a history of fever and acute respiratory illness. This symptom started on the 10th of March. This case had traveled to Germany and Turkey within the last 40 days. Samples were taken, sent to the lab, again, the Gucci Memorial Institute Medical Research, and the report came back as positive COVID-2019. Both cases had no symptoms on arrival, but presented with symptoms of fever and acute respiratory illnesses, and they were not having signs and symptoms time they were crossing our borders. Both are currently under treatment in stable conditions. Contact tracing has started. This brings to a total of 6 confirmed COVID-19 cases in Ghana, with no death, and this is the situation as at close of 14th March 2019. That was yesterday. All the cases are small. All the 6 cases were imported into the country. Distinguished ladies and gentlemen, permit me to use this opportunity to remind all Ghanaians and people living in Ghana to adhere to the preventive and precautionary measures. Key among those are as follows. Wash your hands regularly and thoroughly with soap and under running water, and use alcohol rubs, sanitizers frequently. Avoid shaking hands. Cover mouth and nose with tissue when coughing or sneezing. Dispose of the tissue immediately into trash bin. Keep a distance of at least 2 meters away from a person with fever, cough, sneezing, and difficulty in breathing. It is advisable to be physically active. Everybody is advised to drink plenty of water. You have to eat healthy food, avoid stress, have enough rest, have enough sleep. Restrict travels to essential travels only, as directed by the Excellency, the President. Stay home if you feel unwell and symptoms of fever, and having symptoms of fever, cough, and difficulty in breathing, and call the following number immediately for help: 0509 497 700, 0558 439 868. Before I take leave of you, just a brief about the details of the various cases that we have had with respect to the contacts that we are managing. First 4 cases, contact tracing has started. The last 2 cases we just confirmed over the night, and we have started mechanisms to identify the contacts. Case 1, the contacts, the location, there's a man called Seth. The location, we have identified 2 contacts, and all the contacts are being traced. Case 2 is a Norwegian. We have identified 107 contacts, and 68 of them, we've started process to follow them up. The rest, in the close of today, you'll be in touch with them and support them with regards to their contact tracing. Case 3 is a student, and out of the various, for now, we have identified 12 contacts. We are still in the process to work assiduously to get more. And the last case, the 4th one, the place residence is Obuasi. Currently, we've identified 10 contacts, and all the 30 contacts are being followed up. Thank you very much.
Thank you, Dr. Bedusa Kodie, for that update of the index cases, contact tracing, and 2 new cases. Later, we would direct you to a platform that there will be regular updates of any cases so that we avoid all media speculation, and I'll go into that in some detail. But there's something that they call the triage protocols. When people with suspected incidents first show up at hospitals, I want to invite the Director General of the Ghana Health Service to reiterate what has already been announced, but it's important to reiterate what these triage protocols are. Dr. Baji.
Thank you very much. I want to stand on the existing protocol and go straight. I think this has come up since the outbreak to ensure that we protect staff and patients. And so we have two stages of pre-triaging and triaging. The pre-triaging means that at the outpatients especially, where we have patients that are coming, we will be asked to see whether you have any respiratory condition, cough, sneezing, fever, etc., and separated so that you do not go into the outpatients and sit among other patients, and especially how people will be seeing you. So those doctors who will be seeing those patients will also be protected, will have to wear some masks and also be able to review and see whether you are a suspected case and how you are treated. This is done to ensure that patients are kept safe, especially those who don't have the condition, do not have to mix with other patients and spread the disease, and also doctors, nurses, and health workers, records officers who are attending to these patients are also protected to reduce any level of fear among others. This is something that we have instructed all our facilities to institute to ensure that people feel safe going to those facilities, and people who are there are protected from getting in contact with people who may be as of COVID-19. So thank you very much.
Dr. Patrick Abuaji, thank you for reiterating those triage protocols. Ladies and gentlemen, the government of Ghana is issuing a travel advisory this afternoon. And the travel advisory is as follows. We'll give you copies subsequently, but I'll read it out to you. First is that all travel to Ghana is at this stage strongly discouraged until further notice. Second, any traveler, except for Ghanaian citizens and persons with Ghana residence permits, who, within the last 14 days, has been to a country that has recorded at least 200 cases of COVID-19, will not be permitted into the Ghanaian jurisdiction. Airlines are instructed not to allow such persons to embark. Border posts are instructed not to allow such persons into the jurisdiction. 3, there is now going to be a mandatory 14-day self-quarantine for persons who are otherwise allowed to enter the Ghanaian jurisdiction. Guidelines for the self-quarantine will be available at the various Ghanaian ports of entry. Enforcement protocols are being deployed in collaboration with the state security and health authorities. Persons determined to be able to satisfactorily self-quarantine will be quarantined by the state. 4, inadmissible traveler who